very warm welcome, everybody. I hope that you're all well and healthy. I welcome you to this event organized by the Romani Studies Program at the Jewish Studies Program. And it is also probably one of the last events organized by the Nationalism Studies Department, and at least in its current forms. And therefore, I'm very delighted that you're here, both in person and online. This is an event on the occasion of 5 years since the beginning of the pandemic and the first lockdowns 5 years ago. And for many of us and many around us, this was a traumatic period for many with psychological, economic, social, and political ramifications that last until this very day. From the beginning, and this is what we're focusing on, we saw the targeting of minorities, initially, especially people perceived to be of Asian or Chinese background, leading some commentators very early on, already in February 2020, to speak of an epidemic of racism. And at the center of this are structural inequalities and discrimination, as well as conspiracy theories, some building on age-old traditions, and the rise of the far right and racist conspiracy theories. Today, we appear to have collectively decided that COVID doesn't exist anymore. Nobody has told them, but fair enough. But the surge of racism, anti-Semitism, and conspiracy theories, the radical right, and so on, certainly never went anywhere. And we have to reckon with this and try to understand it as a precondition for countering it. That's why we decided together to organize this event centering on three aspects: conspiracy theories and the far right, racism against Roma communities, and anti-Semitism. And I want to thank Martin for co-organizing this. This was a joy to do.
Thank you, Jan. Yes, I would just like to welcome the audience, and we are really happy to co-organize this very important event. Unfortunately, last minute, our co-speaker Lydia Gabcova fell ill, so she will join online, but we will make a presentation together. And again, thank you for coming, and thank you for the panelists as well.
Yeah, my role will be here. Good evening, by the way. My name is Matthias Möschel. I'm the head of the Legal Studies Department. I'll be moderating the debates and introducing the panelists very shortly. Maybe on this very important topic, maybe there's two reasons that I'm particularly excited to be here, apart from cooperating then with two departments in a certain way of programs. One reason is more professionally that I've been working on racism and anti-discrimination in my scientific work for many years now. So it's very timely to look at this thing in this anniversary, so to say. Another one is maybe a little bit more personal in the sense that when 5 years the whole thing broke out, it's still sort of in Budapest, but I was born in Milan, grew up in Lombardia, which was the area that was first hit. And so I had to witness directly, had parents and my husband that lived in that area, and then witnessing firsthand what was going on. So there is a sort of like the professional side of this and the personal that I find particularly relevant, at least. So that's why possibly I'm sitting here as well. Now, to introduce the panelists, we have a wonderful setup, and I introduce them in the order that the talks are going to be made. So to my right, we have Ruth Wodak from University of Lancaster, but also long-time professor visiting professor certainly at CEU in the Nationalism Studies Department, and who's going to be speaking on conspiracy theories, the radical right, and the global health crisis. Then afterwards, we'll hear from Martin Rövid from the CEU Romani Studies Program, and Lydia Gabcova, who's online, who's the former principal project manager at the Plenipotentiary Office for Roma Communities of the Slovak government, a very short title. And last but not least, we'll then move to Jan Rybak, who's from the CEU Jewish Studies Program, who's going to talk about the oldest hatred and the new plague, anti-Semitism in the COVID-19 pandemic. All of you have roughly between 15 to 20 minutes. I'm told that you're all very good on time, so my moderation will be moderate. So I'll trust you blindly. Anyway, many thanks to everyone, and yeah, the floor is yours.
You can also see up there your slide.
Yeah. Excellent. Yeah, thank you. I will also just say a few words. I'm particularly grateful to be invited today, not only because I've been working here or giving lectures and courses for, I think, 6 or 7 years. I started out in Budapest and then in Vienna, but also because, of course, the pandemic has really been a tipping point for, I think, all of us. And it's been something which, a phenomenon which we haven't really studied enough, and where everybody I meet anyway has specific memories or sort of specific issues which they haven't been able to cope with, be it that one lost friends because one didn't have contact anymore, be it because the children have psychological problems, or because of long COVID, which is, as you know, a terrible illness. So all of us are still in some way inside, although we think we're outside. Yeah, and so I was very grateful to be invited when Jan wrote to me. And as you see, I'm talking about conspiracy narratives. Yeah, and I think I did ask you to change theory to narratives, but never mind. So I could say something about it, because conspiracy theories are not theories. Yeah? No theory in any scientific sense. Yeah, there are no hypotheses. You can't validate them. There's no data for them. They are narratives which help people to hang on to something, yeah, which explains part of the world anyway, and which specifically during COVID and the pandemic help people to cope with the pandemic in a strange way. But that was certainly something which we have to consider. So I will talk about narratives and not theories. So if we go back to the time 2020, and I can really remember very well March 2020, there was a big debate about a big festival to take place at the University of Vienna. And the correspondence went back and forth. So every hour it was canceled, then it was on, then it was canceled, yeah. And finally it was canceled. Lots of, as you know, everything then was canceled suddenly. And this sort of rupture in our everyday lives was very strange. And so I don't know who was in Austria at that time, but we had constant press conferences, which were televised. And so from morning to evening, I think we had at least 3 press conferences a day, sort of a quartet or a trio of politicians arrived on the stage and told us what the new developments were. And so everybody was kind of glued to television, and hoping that there would be some good news, which weren't, especially as you said, Northern Italy. I mean, those pictures, I think I will never forget. And so what were the most dramatic changes, yeah, from sort of the other agenda we are used to in the news? It wasn't international relations or something happening in Sudan or elsewhere. It was health. Yeah? Healthcare became the issue number 1. And suddenly there were very many experts live on television, people who we had never heard of before. It seems like in Austria there were so many virologists suddenly, although that was never mentioned beforehand. Virologists, specialists on vaccines, psychologists, economists, and science had a very big role to play. And I hope we will talk about that maybe in the discussion, because you might know that Austria is the most skeptical country towards science in the European Union. And part of that also has to do with the pandemic. So there were all these scholars, and I think they confused the viewers more than they explained stuff. Secondly, we had this phenomenon of what I call message control, and which was officially called like that. That was under the then Prime Minister Sebastian Kurz, who had a very strict press politics. And they would censor news, they would give out specific news every Monday, and the journalists would gather and they were told to write about this topic and not another topic. And interestingly, although we are a liberal democracy, people followed, yeah? Which is something I really never understand, but they did. And Kurz intervened very frequently in news agencies, called and said he didn't like that report and they should cut that out, and that happened. So there was a very sort of restrictive press dissemination going on. And the third thing at the beginning, which I would like to stress, is that the far right, the Austrian Freedom Party, FPÖ, at the very beginning, supported all the measures of the government. Yeah, they were also panicking. And only after the summer 2020 did they start with their own campaigns against the measures of the government. But first, they supported them. So we can ask ourselves, what made the difference? Why did they suddenly stop? And as I already said, there was a lot of expert discourse, new knowledge, new vocabulary. If you look in the Duden Mannheim, which is a very big platform, online platform of Austrian German and German, you will find a whole lexicon of notions which were invented actually during the pandemic. New words, new metaphors. There are books written about that already, so I'm not going to go into that. So what I'm doing today is talking about the conspiracy narratives, and I would like to start with a discursive strategy, which I call the Judeus ex machina strategy, which means that whenever there are certain issues and problems perceived by politicians, they need scapegoats, and very frequently and throughout history that were the Jews. And this Judeus ex machina strategy popped up immediately. Interestingly, also with people who are not Jewish. So Bill Gates was blamed for all kinds of stuff, but basically it was usually Soros. Rothschild came up, yeah, and I will show you certain examples of the Austrian case. So this Judeus ex machina strategy is very powerful. We can observe it frequently. You can observe it in the US right now. And the anti-Soros campaigns are very frequent, and there's always an argument. Well, why do far-right leaders like Israel and like Netanyahu? Well, extreme right likes extreme right, and their enemies are the other enemies. But as soon as they are left-wing or liberal, then you are excluded. So I think it's very easy to explain. Also, Orban liked them, loves Netanyahu and they hug, but hates Soros. So what are the elements of a conspiracy narrative? There are 6 elements. Of course, they can be structured differently. It's basically a plot, yeah, a story with a coda, some kind of moral ending. And it starts with an alleged secret conspiracy. Some people are getting together somewhere. Remember the conspiracy narrative about the pizzeria in New York or Washington during the campaign Trump versus Hillary Clinton. Then there is a group of conspirators. So you have to identify this group. Who are they? Yeah. Bill Gates, others. And then you legitimize your assumptions by some kind of evidence. Yeah. And these are usually disinformation because they are not facts. There are other stories, what somebody heard, that somebody saw, etc. Or they are just quote unquote fake news. So then there is this narrative which is coherent. Yeah, there is nothing happens by chance and there is no coincidence. So everything fits together and it's a coherent story. Yeah. Completely Manichaean. So everything is good or bad. Yeah, there's nothing in between. And finally, all of that serves to scapegoat certain people or groups and exclude them. Yeah, they are usually vulnerable groups, but not always. It can also be the United Nations, the WHO, all kinds of international organizations. So they don't have to be minorities. Yeah, they can be, but they don't have to be. Historically, it's minorities. Yeah. So to continue, I would like to also mention the concept of flip-siding, which is part of these narratives, that suddenly certain concepts which we know and have used in a certain way, traditionally and by convention, are flip-sided. They are suddenly taking on a different meaning. So what we were able to observe was that the far right suddenly said, we stand for freedom, democracy, and justice. Yeah? And they were fighting for these values. And obviously, what they thought freedom, democracy, and justice is not what we conventionally thought and think that freedom and democracy and justice are. They were fighting against the Corona dictatorship, for example. That was one of the claims they made, and people always asked and said, well, they have no clue what dictatorship really is, because they were allowed to demonstrate. If you are in a dictatorship, you're not allowed to demonstrate. Yeah? But they were those fighting for freedom against the elites. That is a very old pattern for the far right. And the elites were the government, the press, the academics, and the journalists. Yeah. So they took over their traditional pattern of fighting against the elites. So just to show you some of those pictures which went viral, these are pictures from Ben Garrison, who's a caricaturist, an American one. You can download those for free. He's far right or extreme right, whatever you want to call it. And he really began an anti-Racism campaign. And you see here two, I think, metaphorically excellent caricatures of how that narrative works. Yeah, the world conspiracy. So if you look down at the picture which is underneath, you see that at the very top there is Rothschild, who has puppets on his strings, then is Soros, and then the diverse generals are doing what Soros and Rothschild tell them to do. Now, this is a very old, and I guess Jan will talk about the origins of the world conspiracy narrative. I don't know, but you might know the Elders of Zion. There has the Dreyfus affair. It has a very long history. And there's a collective memory. You can kind of use that always to sort of start with this Judeus ex machina again. And the image on the top is very interesting, but I can't go into it now in detail. But you see Soros, whose name is written with a dollar sign. That means he's very rich. It's always the rich Jews, yeah, as if all Jews would be rich. And it's D-Day. So again, a indicator to the past, yeah. And then you have Soros, who has swallowed all the migrants, and out of his mouth, like traditionally out of the Jonas the whale, yeah, mouth, come all the migrants, the Mexicans, yeah, cross the border to the States, which is, as you know, defended by a wall and by military and whatnot right now. And they spread on the poor American who's lying on the ground with his American flag. So this really shows Jews are powerful. They can do everything because the puppets on the string. And this explains also why the pandemic is here. And I want to show you now, going to Orban, the Soros plan, yeah, which she elaborated in 2017. So it's not during the pandemic, but you know, that was repeated quite frequently on the basis of this plan. So these conspirators have a plan, yeah, where they get together and then they implement this plan. And so the Soros plan would settle 1 million immigrants in Europe every year, yeah? And according to the plan, they would give each immigrant 9 million forints from taxpayers' money. I mean, this is all fantasy, yeah? And the Soros plan endangers our community. It endangers Hungary and the whole of Europe as we know it and love it. So there you have the blaming and the scapegoating in Hungary, which has taken many different aspects and dimensions. So to show you some pictures from Vienna during the pandemic, in Vienna there were demonstrations every Saturday in 2022. Against the vaccines and against being forced to get vaccinated. Yeah? And what did people do? This was a mixture of civil society, yeah, men, women, families, children with their buggies and so forth, neo-Nazis, the Austrian Freedom Party, which instrumentalized these demonstrations. And Herbert Kickl, the leader, gave big speeches at these demonstrations. And he also denied COVID and suggested one should take some kind of strange plant disease spray or something. And not dissimilar to Trump at that time in the States. And you see there were huge masses of people, and people were interviewed if they don't mind marching with neo-Nazis and Reichsbürger and so forth, and they said no, they don't care because, you know, it's our health and never mind who we're marching with, which was also strange. You see the picture of one of those demonstrators with the yellow star. And I thought that was really, really terrible, I must say, because that is a relativization of the Holocaust. Yeah? So on the yellow star, it said not vaccinated, ungeimpft. And what this is supposed to indicate is we are treated like the Jews, yeah, and deported or exterminated. And that was sort of course, again, an indicator to this conspiracy theories narratives. And then you have this very interesting lexical item, Corona-Wahnsinn. That means Corona, how would you translate? Craziness. So against this, the measures of the government. And those demonstrations only stopped when legally the law that people should get vaccinated was abolished. Then they stopped. And basically the far right then started their rise, yeah, and that you can really correlate statistically, which we have done in the newspapers and in the mentionings, that once they saw that as they had won that fight. Yeah? The law was abolished. One didn't have to get vaccinated. You wouldn't be punished if you were not vaccinated, and thus they won. And the votes for the far right in areas of Austria where there were the least vaccinated people were the most far right votes. So there is a very clear correlation. So this is a website which I would suggest you look at, the Globalists. That's a new narrative of the FPÖ before the election last year, which again shows that the WHO, the United Nations, any international organization you can think of are conspiring against us. Yeah, and all of this is framed by the term the system. So the system, of course, that has Nazi traditions, that you say you're against the system, and that is very apparent here. So my last slide, what do we learn from this? What we saw during the pandemic was a very strong renationalization. Every country for itself, except actually the EU, which did do collectively a lot of stuff, organized vaccines and so forth. There was a lot of vulnerable groups which were excluded, elderly people, sick people, children. Yeah? There was obviously a rise of authoritarianism. There is an instrumentalization of dissatisfaction, discontent, loss of trust in the elites, and that also supported the rise of the far right. And there was the flip siding, which took off enormously, and which, if you look at political communication right now, you will see it's very apparent, this sort of redefining concept. Yeah. And with this, I'm finished. Thank you.
We'll go directly on to CM.
Yes. Thank you so much. And we divided our presentation with Lydia Gapsova. So I will speak for 10 minutes on the general context a bit of anti-Roma racism and the pandemic, and she will tell you the Slovak case. And basically in my presentation, I will talk about three topics. And one is that the pandemic had a significant and disproportionate impact on Romani communities. Second, I will also talk about some positive practices and what I call unlearned lessons, or what are the systemic issues that still persist and were exposed by the pandemic. So concerning the key impacts, it increased health risks, heightened health disparities. We know that Roma communities faced higher infection, hospitalization, and mortality rates. Higher rates of asthma, diabetes, and heart disease increased. Vulnerability, overcrowded housing, and poor sanitation led to hygiene challenges. And more importantly, there are very significant healthcare barriers that were reinforced during the pandemic. One is discrimination. Second is the lack of insurance, social insurance, and vaccine hesitancy that hindered testing and care. The second big area concerns education, and we know that pandemic aggravated educational inequalities. There were school closures, and distance learning didn't work for many Romani children that have access to equipment, digital devices, reliable internet, or suitable learning environments. The digital gap increased. I will not put this presentation, but from Slovenia, we know that 62% of non-Roma children have access to reliable internet and computers, and it's only 50% for Romani children. And last but not least, there is the phenomenon of student disengagement, which basically means that if the only alternative is distant learning or spreading some materials on paper, there is no meaningful education. So students were disengaged during lockdown. And we have one estimate from Romania that it was 40% of Romani students who were disengaged from school. The next area is labor and economic precarity, where we know that reliance on the informal sector led to great financial strain. Lockdowns resulted in the loss of crucial daily and occasional work. Income loss made it challenging to afford food, even basic hygienic products. Many of you remember that the lockdown meant closing the national borders, also sending back migrant workers. So many of them who returned to their home countries faced insecurity and scapegoating upon returning home. And most of the people who lost their jobs or who had very precarious jobs were not qualified for any kind of state support or unemployment benefit. And this is probably the area that will connect much of our presentations today, is that pandemic increased discrimination and stigmatization. And I think by now it's very clear that it amplified and existing anti-Roma prejudice and racism. The scapegoating was very widespread. Roma were blamed for spreading the virus. Hateful reactions and hate speech amplified in media, partly by officials and politicians. There were disproportionate lockdown measures. And one extreme case was in Slovakia that Lydia will tell you, but Slovakia was not the only country where there were extreme lockdown measures. Bulgaria is another country, but also there were other countries as well. What were some of the positive practices? We are aware of good practices by mediators who bridged the gaps, who acted as trusted bridges between Roma communities and healthcare providers. They conducted door-to-door outreach to disseminate information. They distributed educational materials, provided some digital support. We are also aware of some community leadership projects, Roma-led policies. And finally, the digital networks were used for maintaining connections and facilitating information sharing. And just some more examples from this. I think this example is from Spain, where there was a multilingual content for various platforms in Romani and Calo, using various formats on WhatsApp, community radio, storytelling, creating content with Roma-led NGOs. In some other countries, the COVID-19 safety was integrated into broad educational programs, which apparently worked well. And there were also some attempts to bridge the digital divide, for example, providing free SIM cards or tablets to students in settlements. And this is my last introductory slide, that what were the unlearned lessons? I think one lesson, and why we are here, is that the COVID pandemic magnified pre-existing inequalities, and it's true for every crisis, not only the pandemic, but now we see the war in Ukraine, for example, which has similarly devastating impact on Roma communities. Anti-Roma racism was aggravated by the crisis. We know that trust would be crucial, to trust authorities, to trust healthcare, but we see very few successful programs to build trust. We have been also advocating for disaggregated data to know the numbers for Roma and non-Roma population, but we know it is not collected and there are many obstacles. And we also know that solidarity and collaborative programs could be successful. So these were some of my introductions, and then I would invite Lydia, and I have your PowerPoint here, to give you a presentation on Slovakia, please.
Yeah. Hello, can you hear me properly, please?
Yes.
Yes, it's okay. Okay, so good evening to everyone. Thank you for having me on this at this event, and I'm apologizing for not being able to attend by person, but that's the life sometimes, and thanks to technologies we can adjust. I will try to bring you information and share experience while implementing a big project in Slovakia 5 years ago when the pandemic situation appeared. But this is going to be the mix of experiences, but then some general wrap up findings through these different activities. So just to be in the picture, it is not in the slides. What was the project about? It was actually even the Martin already mentioned that Slovakia was not really well known for closing down some settlements. I think in the beginning there were 3 of them, and they were like with the completely closed down and locked down, and there was no access to the facilities, to the healthcare, to the food, even to the water. So there's supposed to be assistantships further on, and they kept these Roma citizens like for months in these locked down settlements. But there was a very big feedback from the Roma sides and even from the general civil society activists that this is not possible to deal with the pandemic situation in this way. And there are across Slovakia like around 600 Roma communities. So then the government came with a solution to allocate some millions of money, like let's say 5 millions for sort of small type of the projects, but really intense and assist in order to assist with to Roma communities. But actually, the aim of these projects was like to assist to those communities which are approximately around 50 up to 300 Roma people living there and not having any type of the assistantship from the EU funds so far. Because maybe you know, maybe not, in Slovakia there are several national projects, let's say in community workers, field social workers, and so on. So these were also run either by the Ministry of Social Affairs or by the Office of the Plenipotentiary for Roma Communities. As I mentioned, in Slovakia we have 600 Roma communities across Slovakia, so it's quite a huge amount, and that's why these two ministries or 2 state institutions are sharing the responsibilities for implementing their activities. So then when in summer 2020 came the solution that we are going to open a new intensive projects in those new localities, I got actually invitation and to return back to the office to develop this kind of the project. So we had like 6 months to start the big national project, which supposed to be in 400 small municipalities, but we managed to engage like 200. And around 216 assistants, they were working for these Roma communities. As I mentioned, the allocated money were 5 millions, which are not even spent all of them. And the basic idea was to provide 4 type of the areas, actually, or to address to 4 type of other areas. One was like the communication with the Roma in order to avoid all this misinformation about the virus, later on also about the importance of the vaccine, to explain them the basic things and to actually lead them through all these processes. And then there was a discussion and always consultation with the director of the hygienic office. There was assistantship of the healthcare through the medical people like doctors involved in the project directly, which were helping us to provide official and actually expert news about anything that was going on through the pandemic period and to explain in more understandable way for the Roma people. And we were translating, for instance, all the materials and spreading in communities in specific languages in Roma and even in Hungarian languages in the south of Slovakia. And then the last topic was providing food support for the poorest communities. So we were cooperating either with the private companies which were donating food or with the World Bank, the food bank based in Slovakia and That was also one of the basic service we were providing to those which were in the risk of the getting not having access actually to the food because of the loss of the jobs, or not having access because they were locked down and closed the access to the facilities. So what was the basic findings, let's say, from implementing these projects through, I think altogether it was more than a year, actually 12, maybe 15 months. The last activities finished in January or February 2022, started October 2020. And as I mentioned, 200 municipalities, 200 assistants, over 200 assistants were helping to the Roma people. So actually this is activity organized by the state governmental office, but still it was full of, because it was like intensive, it was done on very, very quick and not expected actually event. Nobody was prepared. We didn't really have methodics. We didn't really know how to deal properly at the beginning with all the things, which pandemic brought. Like even Martin mentioned, like let's say the education of the children or other type of the things. But we had to face it, and we had to adjust very quickly and provide as much as possible information and assistance to the Roma communities, which were really vulnerable, and they would be not able to survive actually without help. So going back to the discriminatory lockdowns in Roma settlements, the beginning of all the, let's say, the process, when the pandemic started, was this infamous locking down the communities. And it was really, really very shocking, even I think. A lot of people protested and were not really happy about having the solution for the Roma, because on the other hand, we were listening in news from the diverse media, and there was no information about that some non-Roma quarter was, say, in the same way closed down, that the non-Roma people would be denied the basic access to the services, let's say, like the Roma were, right? So there was no convinced or not even proof the situation or case where the Roma really were the spreaders of the disease, but still you could find that time the information in the media. So that was really unjustful and discriminatory towards the Roma. And to be frank, I'm not really sure if if someone is following that. And but in my very personal opinion, that should be something which should be maybe taken even to the court, like injustice done to the Roma people. And why was it like discriminatory further? Because as many of you might know, how the Roma settlements look like, let's say in Slovakia, a lot of them are segregated, very hardly segregated from the basic, the main municipalities. They have like few kilometers to walk to the schools, to the shops, to the doctors. They don't really have the normal roads, not really access to the water and so on. And with this poor infrastructure and being so isolated, it was really difficult to deal for them with being still like locked down, right? With not really having access to anything then. So we were basically really bringing to the border where the soldiers were at the beginning of the village, water and some basic food the first day. It was really awful situation. And the communities were not small. There were like thousands of Roma living in those 2 or 3 municipalities. One of them was even smaller city. Part of the city, actually. So, for instance, in Bistrani, it's around 2,000 Roma living there. It's northeast Slovakia, Roma settlements. They were actually experiencing the negative consequences of these extreme measures. And then the local leaders and Roma organization implemented more community-driven approach, which ultimately proved that it is more effective solution than in order to control the spread of the virus, right? So they were teaching Roma how to behave in order to not spread the virus, keep all the rules which the hygienic leaders and the hygienics directors actually were giving as a rules generally for all the populations. Those Roma leaders were going to the Roma communities and teaching them in a more understandable way and more easy way to keep the the necessary things, not get ill and not and deal with all the things which were in contact with the virus. So
just let me know if I should move the slide, Lydia. I have the
yes,
control of it.
I will tell you. Sorry, there is one more sentence from this one slide. So the key lesson from this is that actually this excessive policy intervention is failed. It was not good at all in any manners to make the lockdowns. And then it showed up that the community-led prevention worked better. So in order to protect the public health and Roma, in this case also the Roma health. So I would say that this is so sort of highlights why this systemic change and inclusive crisis management are essential in preventing future discrimination, right? So that would be the lesson for the future situation if this something similar appears in the future. It's a quite dangerous situation what appeared like 5 years ago. And the second slide, okay. So what are the alternatives approaches preventing the lockdowns, right? There are cases of the few municipalities. Just like to have idea, for instance, somewhere they build a trust through the meetings, having ensuring voluntary safety measures. In Rimavska Banja, they established local COVID-19 testing, reducing travel and outbreaks, and in Bistrani, they shifted from lockdown to prevent the local leadership. So this lesson learned from this is trust and communication through the police enforcement, then providing resources, testing, hygienic kits, working better than punishment, which appeared quite in not only in these municipalities but in many others. And then in the not last but not least, not last but the least, Roma-led initiatives are key to public health compliance. So this in this in this sorry, I just lost the things. Hesitancy. Where is it?
You can also slowly wrap up because we are. But
Yeah.
as you
So
we are with the next hesitancy. Yeah.
Yeah, I want to suggest like to this addressing the community vaccination hesitancy, but because it's also connected to the information we heard before. There were many like misinformation and hoaxes spread in the Roma communities, and they were really afraid to go for the vaccinations. So there was a lot of the work to be done through these field assistants to explain them why is it sort of safe and what is the meaning of the getting vaccinated, and how they could actually keep their health on the better level. So through this project we prepared also a campaign. On the end of the presentation there are lines just for illustration how the campaign looked like through the social media and through diverse video recorded with some activists from different institutions across Slovakia. And what is the key reason for vaccine hesitancy? The mistrust in authorities due to historical discrimination. That was just the basic experience of the Roma people, especially those living in the settlements, that due to the long-term exclusion from healthcare system, they were not really having trust in doctors, right? Then the experience of many Roma people is that they are facing discrimination in hospitals. There is not so big proper medical care accessible to them, and all these things actually influences their attitude towards the vaccination. Plus, people were really very skeptical about the government the vaccination campaign. They were fearing that they're going to be experimented or ignored, or there's something bad is going to happen to them. So it was very important to spread the right information. And then in the end, we achieved quite, well, it's discutable if it's huge, but I think around 10% of Roma people were in the end vaccinated from these municipalities. And what was quite difficult also in some Roma communities, it was the fact that there were like religious beliefs which influenced vaccination acceptance, because some religious leaders or traditional healers held strong influence over medical decisions, so they were not really allowing Roma to go to the vaccination, and it was quite difficult to go through these leaders and to convince them or to change their mind actually. And what was the solution of all these activities? It was the campaign I mentioned. We call it like join us, get vaccinated. And we were like focusing on clear, accessible information to combat misinformation. So that was the main task of the projects, to provide very clear type of the understandable information for the people through the videos, posters, social media content. It was also like the posters and all the leaflets were spread in the Roma communities and to the starting from the mayors to the community centers and directly to the Roma settlements. And then the Roma community health workers engaged directly with families. They were visiting them, talking to them, explaining the things. So they were trained through the health workers. They went door to door, speaking directly with families. These health workers served as bridges between the Roma population and healthcare institution, and they helped to rebuild the trust which the Roma people were lacking towards the health institutions and the doctors. And the personalized conversation proved to be more effective than generic government campaigns, as they made people feel heard and respected. That was quite an important lesson learned there.
Lydia, could you wrap up slowly, because I was indicated that we are running out of time.
Mm-hmm.
Yeah, maybe one or two final key points.
I will. So then, okay. Just I will skip this. Take over. Mm-hmm. So the COVID pandemic exposed deep-rooted inequalities that Roma communities have faced for decades, and from discriminatory lockdowns to healthcare exclusion and vaccine hesitancy. The crisis highlighted systemic failures that must be addressed. It also proved that community-led solution work, where Roma communities are included, public health measures become more effective. So the key takeaways for the future: discrimination weaken crisis response. Future emergency measures must be fair and equal to all citizens. Healthcare access must be priority. Roma communities need mobile clinics, better healthcare services, culturally sensitive medical support, and ensure long-term inclusion. Trust and communication are essential. Without trust, vaccination and public health efforts fail. Governments must involve Roma leaders, listen to community concerns, and provide reliable information in accessible ways. Investing in Roma-led initiatives in the way forward. Most successful pandemic responses came from within Roma communities, supporting local organizations and community health workers, ensure long-term resilience and better crisis management. So the pandemic was not just a health crisis, it was a test of social justice. The way Roma communities were treated reflect a broader pattern of exclusion that must change, and we know all of that. We know that who is working in this area. If governments and policymakers fail to act, these inequalities will persist in future crises, and we are not going to move in any areas of Roma communities. Thank you for your attention. And as I just one more sentence. These links, I don't know if there is, I guess, no time anymore. But if there will be like in the end, I just would love to show one of the video, because there is a reflection of the mayors at the end of the project. They were giving the feedback how the projects helped them and what they achieved through the activities. Thank you.
I think we'll add a bit more time at the end for more questions, because we started late and so on. So I'll be talking about anti-Semitism in the wake of the COVID-19 pandemic, and I'll be bringing some examples Some of them may seem rather anecdotal, but I do think that they point to a larger pattern. And I'm interested in this pattern and what it tells us. Now, Ruth already spoke about the Deus ex machina, and indeed, from the very beginning of the pandemic, Jews were accused of orchestrating it, of inventing it, of spreading it, of benefiting from it, and so on. And as shocking as and disgusting as this may seem, the historian in me, says that there is very little new. And in the long history of discrimination and persecution of Jews, holding them responsible for disease outbreaks has been a common thread and a persistent thread. People may be familiar, going really far back, with the so-called plague pogroms of the 14th century, when throughout Europe, Jewish communities were accused of poisoning wells and attacked, leading to the physical extermination of hundreds of Jewish communities in Europe. Throughout the early modern period and well into the 19th and 20th centuries, whatever large outbreaks of disease, and it doesn't matter whether it was cholera or typhus, or the Spanish flu, or then later HIV/AIDS and COVID-19, narratives instantly emerged that blamed Jewish conspiracies behind that. Now, there is a debate among historians and scholars of antisemitism between those who argue that there is an unbroken continuity of antisemitism from the antiquity to the present, and people like Robert Wistrich, who argue that it's been the longest hatred, and others, including David Engel, for example, an important scholar at NYU, who emphasize discontinuity and changes between different forms of discrimination, persecution of Jews throughout history. The point is not to position myself in that debate necessarily, but my point is to look at anti-Semitism in the wake of the COVID-19 pandemic and to contextualize it historically, and then to ask what this tells us about contemporary and historic forms of anti-Semitism. And in doing that, I want to concentrate on three levels. I did write theories that say conspiracy narratives of Jews behind the pandemic, discrimination and attacks on Jews in the wake of the pandemic, and anti-Semitism is relating to the public health protests against public health policies and the vaccine. Now, to come back to that, she mentioned the Deus ex machina, and indeed you find from actually January onwards, January 2020, these very confidently and without any evidence produced claims that Jews were behind it. And this was an international and almost universal phenomenon. You had people from like the former Grand Wizard of the Ku Klux Klan, David Duke, who claimed that, quote, the Jews are behind the virus, to a candidate of the French Rassemblement National who stated the Jews were spreading it, to Fatih Erbakan, the leader of the far-right New Welfare Party in Turkey, who stated, quote, Zionism could be behind the virus, to the Iranian regime's press TV, which stated, quote, Zionist elements developed the deadliest strains of coronavirus against Iran. This was, I could continue for the next whatever with quotes like this. And in many cases, this was linked to these ideas were linked to conspiracy ideas of Jewish economic power, hope for the collapse of the economy, and the creation of what it was called a new world order. All anti-Semitic dog whistles, the anti-Semitic dog trumpet, and much more common than explicitly calling on Jews, especially in the more polite societies. It was references of Assad's terms that say as the Zionist conspiracy or the globalist elites or the like. And what I would like to emphasize, and I'll come back to that, these narratives were often integrated with larger conspiracy narratives, such as that of what white nationalists and neo-Nazis call white genocide, or what, again, the more polite fascists in our realm call the Great Replacement. The Austrian neo-fascist organization, the Identitäre Bewegung, for example, around their leader Martin Sellner, combined their anti-Semitism with xenophobia, blaming migrants for spreading the virus, while holding George Soros responsible for organizing immigration in the very first place. And Ruth showed one of the caricatures from the US. Again, so we haven't hints at that. All this was, however, not limited to fringe people or extremist groups and individuals. One of the more concerning aspects in the spread of anti-Semitism in this period is how mainstream it became. A May 2020 study by Oxford University showed that 1 in 5 people surveyed in Britain agreed to different extents that Jews had created the virus in order to ruin the economy for their own financial gains. You can see the screenshot from the thing over there. So to different extents. I would also like to emphasize that an about similar number of people agreed to different degrees to the sentence that Muslims are spreading the virus and attacking Western values. So again, we see the connection, the intimate connection between different forms of bigotry and racism. A study by the European Commission in 2021 on anti-Semitism in French and German language social media found a 7-fold increase of anti-Semitic content in the French and a 13-fold increase of anti-Semitic content in the German language social media in the first 12 months of the pandemic. Here the second point. It shouldn't be a surprise that the spread of anti-Semitic conspiracy theories, especially online, then also translated into discrimination and views of what we still call the real world. As usual, most affected were those most visibly Jewish, that is, Haredim or ultra-Orthodox, as they're often called. These included verbal abuse, but also physical attacks in the public space, especially on public transport. I will give 2 examples to illustrate that. One case is the Belgian city of Antwerp, where from early on in the pandemic, Orthodox Jews were blamed for the outbreak of COVID. As in this cartoon from a French language, Belgian Daily illustrates, visit Antwerp, well, you can read yourself, after the zoo, we'll go to the coronavirus village. The coronavirus village there with the vultures flying over it. Behind in the back, you see Jewish man or stereotypically dressed Jewish man on his bicycle relating to the Jewish neighborhood of Antwerp. In early 21, when everyone was concerned about the Alpha or British variant of COVID, the mayor of Antwerp accused Haredi Jews collectively of not complying with the public health requirements, and wanted therefore they would bring, quote, a wave of anti-Semitism on them. Whether this was a warning or a threat, one may interpret this they like. He also claimed that the new variant of the virus may have been brought to Belgium by Orthodox Jews because of their close family connection with British Jews. It's not a coincidence that Belgium in general and Antwerp in particular saw a series of attacks and harassment against Jews. One more incident that is symptomatic again, like it could continue and continue, but I don't have the time. One more incident that is symptomatic of this was a Lufthansa flight connection from New York via Frankfurt to Budapest in May 2022. Because allegedly some Jewish passengers on board the flight from New York did not comply with the airline's mask mandate. At arrival in Frankfurt, Lufthansa staff and heavily armed German police segregated all visibly Jewish passengers. That is how German policemen and airline officials imagine Jews supposed to look, from the other passengers, and they refused them boarding their onward flight to Budapest. About 130 in total. The criteria for being refused boarding, and this is the important part here, was not whether somebody individually complied with the mask mandate, but whether they were visibly Jewish or not. All other passengers could go on to their connected flights. I want to emphasize that while I picked only 2 examples, these were symptomatic for a much wider phenomenon, holding Jews collectively responsible for the health crisis and for targeting them, specifically those most easily identifiable as Jewish. So anti-Semite doesn't want to think Jewish. The third aspect I'd like to touch on, and Ruth already spoke a bit on this, is the protest against the health mandates and against the vaccine. With the protests that emerged in the late spring of 2020 and in subsequent months and years against lockdowns, mask mandates, vaccines, anti-Semitic conspiracy narratives were omnipresent. If not a constitutive, that's actually what I would argue, it was a constitutive element of the protests and the rhetoric online. The vaccine itself was portrayed as a Jewish conspiracy to either kill a large part of the world's population or to subjugate them, that it would poison people, contaminate their blood, or mess with people's reproductive abilities. Again, age-old anti-Semitic tropes reproduced by people who may often not even be aware of their history. Now, one common theme was the appropriation of Holocaust imagery, and Ruth already related to that. People rejecting mask mandates, lockdowns, and vaccines portraying themselves as the new Jews. in a supposed new Holocaust, which they had to resist. One of the most nefarious slogans and most common ones of anti-vaccine demonstrations was Impfen macht frei, which you can see on top. Vaccination will set you free, a reference to the slogan at the gates of the Auschwitz concentration camp, equating the mass murder of Jews to vaccination. A second common feature, what I already mentioned, was the use of the yellow star, which Nazis had mandated to mark Jews, and replacing the word Jude, Jew, with ungeimpft, unvaccinated. The common rejection of public health measures and vaccine out of an anti-Semitic rationale builds on a tradition, especially prominent in German anti-Semitism. German culture includes today's Austria from the late 19th century that rejected modern medicine. Modern medicine in general and vaccines in particular is Jewish or as Jewish Marxist conspiracies against the body of the nation. Verjudelte Schulmedizin, it was called in German. Vaccines, a claim that has been made since the 19th century, would contaminate the blood. Modern medicine, in the anti-Semites' view, was a danger not only to the health and body of the individual, but more importantly, to the health of the body of the nation. Not only because it was supposedly run by Jews, but because it undermined the eugenicist principle of the survival of the fittest. In opposition to this, especially from the 1920s, folkish ethno-nationalist concepts of medicine were proposed alongside racial hygiene, as it was called. Biology tied to race, and it truly was tied to race, and in this imagination, a truly Aryan body would be able to heal itself, it was claimed, maybe with the aid of some natural remedies, at times homeopathic droplets. These ideas had long-lasting influences on popular thinking about health and about medicine, particularly in German-speaking lands, but certainly not limited. If one recalls, the opponents of the vaccines and other public health measures proposed as what they proposed as alternatives. This was not, for the most part, this was for the most part ideas of the body supposedly self-healing, self-healing properties, the survival of the fittest. The rejection of the vaccine similarly connected to conspiracy theories about the nefarious cabal's control over the body, not all mankind. It is this anti-Semitic conspiracy narrative that bridges the gap between the nonsensical and like on the surface contradictory ideas of being against all health measures and against the vaccine. These positions both espoused by the protesters. Zero public health measures and a rejection of the vaccine together, they work only conceptually if the underlying understanding is that of a conspiracy, bringing together anti-Semitism, ableism, indeed, and a eugenicist worldview. Now, trying to make sense of that, to the extent that this is possible, I propose three arguments. One, for some actors, it was simply a cynical way to distract from their own failures and inappropriately responding to the pandemic. The aforementioned claim by the Iranian regime that COVID-19 was a Zionist bioweapon was made in late March 2020 when Iran had the highest per capita death rate of any country in the world. This was a means to distract and to find culprits. In a very similar vein, the claim by Robert F. Kennedy Jr., the current US Health Secretary, we live in the best of all timelines, who claimed that, quote, COVID-19 is targeted to attack Caucasian and Black people. The people who are most immune are Ashkenazi Jews and Chinese. This quote is not dissimilar. According to the racist and anti-Semitic conspiracy narrative, the virus has been engineered in a way that would keep these communities safe as opposed to all the others. Then this, rather than the abysmal US health policy, could be blamed for the countless deaths. Second part. Many scholars of anti-Semitism often emphasize its unique characteristic in comparison to other forms of racism. That is, that in the anti-Semites' mind, the enemy is not below, but above. One is all-powerful, controlling the world, and therefore responsible for all the ills in the world. It should not, however, hide the intimate connection between anti-Semitism and other forms of racism, as the quote by Robert F. Kennedy, but also the results of the Oxford study that I mentioned before show these go hand in hand. One more very crass example. In March 2020, the FBI foiled a terrorist plot by white nationalists who had planned bombing a school with a large number of African American students, a mosque, and a synagogue, before setting on a local hospital filled with coronavirus patients. In an online post, he claimed that, quote, this whole thing, meaning the virus, was engineered by Jews as a power grab, quote. But keep in mind this series of targets that he had in mind. In the racists and anti-Semites' mind, these go together, which not only entails the necessity to analyze racism and anti-Semitism together, but also to oppose it together as well. Final and main point, we have this persistent intersection of anti-Semitism and public health crisis. This association is so powerful and so consistent because it connects, and this would be my main point, it's not only scapegoating, it's more than scapegoating. Because it connects to racial and religious ideas of the purity of both the body and the soul. Whereas in medieval times, and arguably later, anti-Jewish discrimination, persecution, and murder aimed to keep the spirit of the Christians or whatever clean of Judaism, modern anti-Semitism wanted to purify the blood, wanted to purify the body of the nation. And in both respects, fear of illness and anti-Semitic paranoia intersect, associating Jews with disease, with known consequences. Indeed, as a historic and present anti-Semitism have demonstrated, it is only a minor step conceptually and in practice from believing in a Jewish conspiracy behind the disease, the Jews as carriers of the disease, to seeing Jews themselves as the disease that needs to be eradicated. At the same time, and this is also something I'd like to emphasize at the end, this also demonstrates how completely self-destructive anti-Semitism is for the anti-Semites and their society themselves. When medieval Christians burned Jews for allegedly poisoning the wells, when anti-Semitic doctors in the early 20th century closed borders to Jews because they thought typhus was a, quote, Jewish fever, and when anti-vaccine activists rejected the vaccine because they believed it was a Jewish poison, they did nothing to address the health crisis that threatened them and their community. Because obviously, germs, bacteria, viruses can neither about ethnicity or religion, nor about conspiracist delusions. Thank you.
So we have time for questions, and there was something for a debate. If I can ask three things that when you ask questions or introduce yourself, ask one question and keep it short. So that way, then maybe you can bring in more people for comments or questions. So yeah, the floor is open. Speak loud. Yes. So fourth conditions. If you can raise your voice so that we hear it. Floor is open. Also to online, in case this is not to include just the people here in the room.
I can start. Hello, my name is Ruth. I have a question relating to intersecting the hate that the right wing might have to different groups. You mentioned that the Jewish people, the Roma people, in some aspects you mentioned also the Muslim peoples, and what about intersecting the hate toward more intersections within society, for example, some gender hate or some sexual minority hate, and because as we see the right wing groups hate a lot of groups, and I sometimes joke and I say to myself, maybe they will start hating themselves at the end. So there is a lot. And what made me think of this is in the metro, it was a right-wing guy entered drunk and started to scream, no Jewish, no Tzigeuner, no the gays, I don't know in German how you say this, Schwul or something. And he mentioned all the groups he could mention. Well, what's your take on that, and how, for example, these groups having conflicts within each other or among each other or between each other can fit the right-wing narrative as well?
Yeah, if you want, if you prefer. seen that at the moment, so maybe if you want, and then maybe others have things coming up,
Just,
because I don't see hands.
I might start with an answer, and others can continue. But if you look at the really seminal work by Theodor Adorno and his group writing about the authoritarian personality, you will see that already then they claimed with their empirical data that there is this authoritarian personality who hates all of these groups. Yeah, so they claimed with their socio-psychological study that their anti-Semitism was linked to anti-Muslim, to homophobia, to whatever else, xenophobia, and so forth, racism, and that was kind of a socio-psychological phenomenon. In the meantime, of course, there are other very interesting studies about intergroup relationships. So, for example, the German sociologist Wilhelm Heidmayer and his group in Bielefeld have done extremely interesting work about Gruppenfeindlichkeit, yeah? The group animosity with also quantitative, extraordinary detailed scales and whatever, but basically showing how this intersection works. And of course, it's also hierarchical. Yeah? So on the one hand, against those who are most vulnerable, the Roma, and against those who are perceived as the most powerful. Yeah, and those are then the elites of whatever kind. Yeah, so you have also this class structure, which is intersecting. So I'm happy to send some references, because I think specifically these German scholars in Bielefeld in that center have done extraordinarily interesting work.
Yeah, I think that anti-racists, anti-Semitic, and so many activists, I'll approach it from a different direction. There is a lot of pressure in our society to divide and conquer. There's a lot of pressure on people to center on the conflicts that they have, and these are real. These needs to be discussed, and nobody should say they don't exist. But I think it is a huge mistake when there's a withdrawal into oneself, because then people become easy prey. And I think this is what we're seeing in the United States very heavily at the moment. This attack by the new administration on essentially everybody who is not a white man, straight cis white man and rich. Every other hire is DEI, right? Everything else is just sorry,
including now Amy Corey Bennett.
Yeah.
So I think in order to challenge that, we also must recognize it would be absurd to let to divide these things, not only from an analytical point of view, but also because the racists, the anti-Semites, the homophobes, they see it as one and the same. I mean, for me, some years ago, there was some neo-Nazis that spray painted on the walls of the Mauthausen concentration camp at the memorial site. Third World War, Seventh Crusade. What for our parents was the Jew, to us is the Muslim. Expressing their ideology, essentially, and it has to be confronted to them. And this goes for other sections.
And just one sentence, because I think Lydia mentioned it, but maybe it's not clear for everybody in the room or online how the Anti-Roma racism manifested in Slovakia and other countries, that it was actually a military lockdown of these settlements. So it was not an extreme night narrative. The state mobilized the army to lock down the people. And what Lydia mentioned briefly, even without any proven case of COVID. So this was a reaction to immediately lock down the settlement with the army. There is no access to any supplies, even water. So this was a state response. So it's you can see how deep is the anti-Roma racism in Brazil.
Violent.
Yeah.
So I see that one hand is raised online. Michael Strmiska or Michael Strmiska.
Yes, can you hear me?
Yes,
Yeah.
perfectly.
Oh, very good. Zoom is working today. I had a question about how the different groups targeted were responding to the targeting in the sense of when different groups, say Roma or Jews or Muslims, were being blamed for COVID, was there much in the way of cooperation between members of these groups to combat these prejudices or conspiracies overall? Or did they actually turn on each other and were some of them targeting each other? Say, oh no, I'm a Roma, I'm not to blame, it's those Muslims. Was there any of that kind of thing? And incidentally, you want to know where people are from? I'm American. I'm currently at Vilnius University in Lithuania. Thank you.
Thanks a lot. Do you want to go first? Maybe do you want to go first?
Yeah, so I mean, many organizations and groups that are combating anti-Semitism also called out racism and discrimination of other groups. This was very much standard practice at the time. I think this must be emphasized as something really positive, and there are great traditions of working together of that. But yeah, certainly like there are conflicts, and that yeah, I think that and just because somebody is discriminated against doesn't mean that they can't be racist or terrible against other people, right? But yeah, I think from what I saw, this was the usual response actually to bring these aspects together.
Yeah, I have a similar observation, especially in Vienna. There are 2 or 3 civil society organizations who cooperate and emphasize these cooperations, I think, very well. One is SOS Mitmensch, who do fantastic campaigns, also with a lot of factual evidence. They study and also publish stuff, and are sort of open to whoever wants to cooperate against racism. And the other big group is Zara, and they,
which you are a co-founder.
Yeah,
right?
Where you can report, also go and report. So, and they help you legally to go somewhere to, because frequently people are afraid to go to the police or to say something, and they do it with you or they do it for you. So there are really well-known civil society groups, but I think during COVID it's very difficult because obviously everything was locked down. Yeah. So you couldn't just go to an organization and talk to somebody. You had to Zoom or know who you want to Zoom to. And in that way, it was made much more difficult. That is sort of my experience.
Yeah, I can give examples, but some of you know the collaboration between Romani and Jewish organizations. Actually, this university and with some of our students, we are also part of such projects where you combine research, advocacy raising. If Lydia is here with us, maybe she can mention examples from Slovakia. But yeah, there are some good examples, I think.
Can you repeat, please, the first half of the question? Martin.
Yeah, or Michael is here who has the question. Yeah.
You want me to repeat the question?
No, I just didn't get the last half of it.
Okay, I was asking, in dealing with the conspiracy theories and discrimination during the COVID crisis, were different groups cooperating with each other, or in some cases, were they engaging in conspiracies against each other?
I don't know how it was in the different countries, but Slovakia had quite strong restrictions within the districts. It was impossible for none of the people move from district to district, right? during the lockdown. So there was not physical cooperation, and then maybe some activities on the social media. I mean, social, mostly through the social media. Maybe there were some initiatives. Couple of people were protesting against this lockdown and so on. But I don't think so. There was some outstanding initiative through the Slovakia. It was not even possible. We were not even allowed to go out. It was restricted, to move, to meet with the people, and that was it.
I allow myself maybe, while maybe some other questions are one thing, and maybe going back to the narrative, questions about the gender dimension. So we talked about various groups, minorities, and so the gendered impact of COVID has, of course, been analyzed, and on the question of being locked in homes, and then that this increased domestic violence and all these. But I was wondering about the narratives in some ways, and how absent, at least, or was it or not? Is it my impression that at least in what you said, and as well, that gender was not at all part of that? Did that come up in some ways, the gender dimension in this, or is this something that where for once maybe we can say, oh, intersectionality or certain things did not appear in the narratives, not in the impact? And I think, Lydia, you had one mention at one point where you're saying Romani women, not necessarily with the impact, but in the way of addressing certain things, that the role of Romani women was particularly important. But I was wondering in the narratives, on the narrative side.
I'm not aware.
Okay.
Interestingly, although we studied a lot of those narratives, there are so many examples of the anti-Muslim, anti-Chinese, anti-Jewish, and so forth, but not anti-female, except if they were experts. But then the expert status came up, yeah? So talking about it now, this comes a bit to mind. In the Austrian television, I mentioned it, there were these press conferences all the time, and those invitations of this whole range of experts. And it was interesting that there were quite many women experts, yeah? Virologists, especially one from Tyrol became very famous, and one from the AKH, yeah? And then psychologists, and the psychologists were always women. So they were professional experts who were gendered in some way, yeah? But it was not made to a topic, yeah? And also I didn't come across, let's say, narratives which would have taken on from there, yeah? That there was a, I don't know, female gaze or something, yeah?
I mean, for me, the only thing that, or the thing that to mind directly is this narrative of the vaccine is going to mess up your sperm, right? So there's clearly a gender aspect to it.
Not the female capacity to reproduce.
I only found it in this respect. So there is this, I mean, in the tradition of anti-Semitism, there is this fear of demasculation and so on. It is there. I didn't find it that prominently presented, but it was certainly a part of it. What was a part of it, and this is something we're going to have to deal with for a long, long time, is I think what the pandemic and the lockdowns really spurred was this online manosphere and this massive misogynistic culture of I don't want to name names, but this really grew massively during the pandemic, and I think it would be naive to think that there isn't this, but it's not a coincidence.
Yeah,
that there is a.
Yes, so we have two hands in front first, and then at the back in the room.
Yeah.
Okay, so I think the lockdowns were quite draconian and quite brutally implemented in most places in the world. Of course, you had places like Sweden that didn't implement the lockdown and didn't actually have more deaths. Of course, it's bad to discriminate one group against the other. Personally, I was involved in demonstrating against the lockdowns here in Vienna, and especially when they tried to make this forced vaccination when they tried to make it compulsory. And I just wanted to say that I hadn't heard, it was interesting information, but during that time, I really didn't notice specific anti-Semitism and also these conspiracies, because I did a lot of reports for Tilos Radio, why people were demonstrating, why they didn't think forced vaccines was appropriate, etc. So for me in this time, the people that one of the best things about the demonstrations here in Vienna was that it was really all groups of people, all together, religious people, non-religious people, all kinds of ethnic groups, with the common goal of saying it's my body, my choice, and for me, that is a given that should be also, there shouldn't be health fascism,
Sorry, did you have a question? I asked.
Yes, the question.
Introduce and maybe ask a question.
Yeah.
Thanks.
So, did you also? I wanted to ask the last speaker that during this time there was also quite a lot of positive things. For example, there were rabbis that were saying we don't want the people to be separated, and there was a lot of videos as well as the conspiracy things, which were actually putting Jewish people in a positive light. And if you noticed any of that at all. And also, if you think that this kind of health fascism to try and force everyone to have the vaccine is the right thing to do within these communities.
So neither of us is a health expert. We're sociologists and historians and so on. And we're talking about sociological and historical and political developments and events. And one of the things that we observe when we're studying this is the enormous presence of racism, of antisemitism, of discrimination, and so on in the realms of these conspiracy narratives, in the realms of the people, or many of the people who protested against public health policy. As Ruth and I both related to, I do think that the equating, as has been done on many demonstrations, equating lockdowns, mask mandates, or even the vaccine to the Nazi regime or to fascism is in itself is disqualifying in itself. What I would like to emphasize overall is there is a social contract in society, and that includes also not only me and myself, but this includes taking care of people who are vulnerable in society, protecting them and participating in this effort, and certainly not to blame minorities, and certainly also not to accept to march with minority, with racists, with anti-Semites on demonstrations. With my take on that?
Yeah, nothing to add.
Abijah.
Yes.
My name's Abijah. So I guess this kind of gets a little bit at something that was being asked in the question before last, which I guess is, especially with like the manosphere stuff, which is, I know a lot of sort of like the narrative behind like the renewed success of the far right, both in the United States and Europe over the past few years, has really been this kind of youth shift, right? This has been a big part of it, right? Is like this sort of like I mean, it's a big thing in terms of like AFD, and then also states, right? And so I guess if do you think that there's connections to this? Because obviously this is a group of young people who obviously come of age during the lockdowns, right? And experience this very formative time. And I guess if you could puzzle that out a little bit, or sort of like if there are any connections between just this specific event at this specific time in life and then this move away, I guess, or towards the far right amongst younger voters and people.
Yeah, just looking at the voters, at the recent election 2024, which we did, and if you look at age groups and gender, you see that the most voters for the Austrian Freedom Party were in the age of 35 until 45. Interesting. There were quite a lot sort of in below, up to 18, and then 25 and to 35. But that was absolutely the largest group. And it also had most, sort of gender-wise, most of the women. Yeah. And the older people got, the less they voted for the Austrian Freedom Party. So we can ask, why is that so? So you had quite a lot of young people, but less than that one age group. And then this specific age group, and there's probably a lot of reasons why, there's never just one, but certainly the loss of trust, and that wasn't just because of the measures. The loss of trust happened in Austria specifically because of the corruption cases of the government, specifically of the Conservative Party, and the chancellor, as you know, had to resign. So people lost a lot of trust. Then there was this whole issue with, as was said before, the compulsory vaccination. So they decided a law which they didn't implement, and then also abolished. Yeah. So you can't think of a more stupid thing to do. Yeah. Because if they would have decided, passed the law, then sort of said, okay, we don't apply it now because numbers have gone down, this, that, and the other. Maybe there will be another pandemic, then we have the law, and so forth. No, they abolished it, which was just exactly what the far right had wanted. And it proved their success. So I think these two things were very strong here, yeah? Because that was such an extraordinarily stupid kind of way of communicating politics and implementing politics. And the loss of trust was enormous, yeah, because there were also a lot of infighting in the government, which was made explicit, the Greens against the Conservatives, and yeah, there was a lot. And finally, I don't think that to compulsory vaccination is bad. Yeah? I mean, it was just, the propaganda was very bad. We were all vaccinated when I was young against polio, against I don't know what kind of illnesses, and I was very, very happy that we were vaccinated against all of that in school. Yeah, just one kid after the other, because these were terrible illnesses, and there was no remedy. Yeah, after the war. Yeah? So this was really instrumentalized, quote unquote, very successfully, and probably this one age group is the age group which was most affected economically. Yeah? With young families, who lost jobs, who were put on furlough, who had children, not enough space at home. You know, there were so many factors at the same time. But that would have to be investigated much more in depth.
I think we could still take, right, a couple of questions.
I'm sorry, but it's also not the question, just a comment. Can I make it?
Yes.
And interestingly, that Europe is like very famous for the measles
Yeah.
cases with the kids, and like how the parents are not taking responsibilities for the kids, and then kids suffer from the disease. And then the second comment is about this narratives and discourses about the fragility, like when you said all of these biases and discrimination, biases and some prejudices. I think the concept of fragility is very central because, first of all, fragility of body to the virus, but also fragility of Romani people to get some medical, medical stuff from the government, but also fragility of the system itself. I think, yeah, that's it.
Just two sentences. First on the measles. Yes, these lands are famous for their measles outbreaks. And the reason is the low uptake of the vaccine, and the reason for the low uptake of the vaccine is the same as you have in this age-old or since the 19th century rejection of modern medicine as it being an evil conspiracy against the body of the nation. This is where it, like, ideologically and traditionally comes from. Small comment on a Bij's question. So what we do see in respect to gender are our divide between young men moving massively to the right and young women actually for the most part moving to the left.
Not here.
But also here you have a lot more men voting for the far right than women. It's always been the case, and it's more pronounced.
Less. Yeah.
And it's more pronounced among young people. In the US, it's even stronger. In Germany, it's stronger. But still, I can't say 100% why that is the case. My take is always that the reason when the left gets strong, when the right gets strong, when the left fails to give credible answers. But that's you can say that in so many situations.
Unless.
I have a question on the because it connects to the question of how did on Romani activism, also political activism. I'm supposed to look there and there. How did that shape? How was that shaped by the pandemic? I mean, there are all these really fantastic local civil society initiatives as responses to the pandemic. Did something emerge from them? Do they continue? Does that influence political activism today, social and civil society activism in Roma communities?
That's a good. I can say a few words, and if Lydia is here. So I collected the good examples. When you go to the community, you convince to take the vaccine, or you explain what is it about, and we shouldn't forget that the context is deep mistrust and structural racism. So you have very good reasons to mistrust the public healthcare where you are discriminated, and the state authorities. But to be honest, I don't know if something bigger developed from these initiatives. But maybe Lydia, you know how in Slovakia it works out. Roma organizations and.
Yeah, during the very intense period, there were maybe cooperation because they were provided not only the information towards the Roma direct in the settlements, but they are mostly the activists bringing some charitable items, either the food or clothes or whatever was needed, or the masks, for instance, all the facilities they were getting for the Roma communities to protect themselves. And I don't think so there is some sustained initiative for continuing in this time or followed by something more conceptual or structural and influencing, let's say, the general policies. This is still remained as the lack in Slovakia for sure.
Maybe common part question, maybe to wrap up in some ways. And I think you mentioned at the very beginning of the talk that clearly there was initially also the narrative about anti-Asian racism, and we haven't really touched upon beyond the comment that you made about the tropes and the narratives and how persistent some of these things are. And I was wondering very quickly, I mean, the whole idea and this idea of what you put up the slides with the 6 steps, or it wasn't steps, 6 elements of how these conspiracy theories come about, and what they contain. And I was thinking, when we apply that to this whole idea of anti-Asian, and that somehow the Chinese created this virus in a lab. And now, ironically, I don't know if you've been following the news in the German newspapers, that seemingly they're hiding. And I was wondering how much of that, whether or not at this point, disproving if there are some facts that show this, but how the persistency of that trope remained, of that narrative. This was a Chinese virus created and leaked by some Chinese lab. Whether you had any thoughts on that. And if then now it turns out that there are some serious proof and facts that back up some of that, at least in some ways, what do we do with that then? Or is this just
there are no facts to support the idea that at the beginning, like in February and March 2020, people attacked Chinese restaurants because they claimed that this is what there's no evidence. No. It's there is racism in all its forms, because it's delusional madness, can never be sustained by any facts, regardless how many facts people make up. And I mean, there was an entire industry, right? If this university would have existed 200 years ago, we might have had a race science department, right? It persists. These anti-Asian, anti-Chinese narratives in itself persist massively. They have led to so much pain and so much suffering in especially Asian American communities, but also throughout Europe and internationally. Has deeply traumatized these communities, and especially young people. You read all these, like when preparing for this, you read all these stories about young people from Chinese American backgrounds, so on, who were attacked by their classmates and so on when going to school, and so like it's deeply traumatizing for people. And I don't know if initiatives have been made to heal from this trauma that communities, everyone experienced in a different degree, but minority communities in particular did. And yes, this like anti-Chinese, again, they also build on very long traditions. The Chinese exclusion acts were very often argued with health policy, they play into contemporary ideas of the Chinese peril.
Yeah. Did you want to say something?
No,
because you showed me numbers.
Yeah.
Something.
I was just
on the previous comment and question. We'll keep maybe things for discussion. Let's keep one last.
It's not a question, it's more how I perceive this with I agree with Jan what you say about like initially in 2020 with this anti-Asian racism, but I feel like this discourse with the new findings of the Koch Institute and the German intelligence and so on could rather, I don't feel that it's right now tied much with anti-Asian racism, but rather with a discourse on democracy and authoritarianism in a way of why has the German government kept this as a secret, even with a change of leadership between Merkel and what's the short? Thank you. So on one hand, the state of our European democracy, and on the other hand, also a discussion on what are we going to do with this big economic partner that China is, and that politically and health-wise is totally unreliable. And yeah, I mean, I have read about this whole these new findings, actually not even that much. It's also a bit disappointing, but I think there would also be perhaps a different look that can be taken now beyond the racism that was especially relevant 5 years ago. Yeah, that's my take.
So I'm looking at time, and maybe it's time to wrap up. It's been a long day, and I would really like to thank the speakers for these wonderful contributions, and everyone online, thank you so much as well for joining us. Have a nice evening or day wherever you are physically at the moment. Bye-bye.
It's going to be my document.